Dear patients, dear colleagues, recently I received so many questions about the possibility of contamination of contact lenses with COVID-19. Of course, it's something absolutely new for everybody. And in this situation of pandemic, everybody worries very, very much. And it's absolutely logic that people are asking about possibility of contamination. First of all, I should say that there is no any evidence that contact lens patients are suffering more from the disease, that they have more risks as well. Of course, it does not mean that we need to open wide our eyes and be very careful about the situation and think very carefully. So the first question I usually receive from patients is, can I continue wearing my contact lenses? And my answer to this question is usually yes. If the patient is healthy, if they need good vision, if they are still working, if they see and feel better with their contact lenses, they can continue wearing the lenses. Of course, the second question is, do I need to do some precautions and some special hygiene for my contact lenses? The answer to this question is that the usual hygiene rule apply, but they should be more strict. What this means? This means that patients should wash their hands thoroughly before removal and also when they try to insert their lenses. The second thing is that they should very carefully follow on the life of the lenses, and they should follow exactly the rules. The third is that they should be very careful about the care system. Of course, there is an option that they wear daily disposable lenses, and this is a very good option because it's proven that daily disposable lenses are associated with less infectious events. However, if they wear lenses for monthly use, for example, they should use solutions, and solutions which are based on oxygenation are actually a better option in this case. But any solution the patient is using should be within the expiration date, and importantly, it should be always fresh. And container. Container is surface, which basically means that it can be a source of contamination. And because of this, taking care about the container is extremely important. Container, when there is no contact lens inside, should be stored in dry status, so no solution inside. And also, it is very important that the containers are changed every month. So your favorite container even should go to the bin every month. Another question that my patients are very often asking is, if I am positive about COVID-19 and I do not know about this, can I transfer infection with my contact lenses? Well, basically contact lenses are staying on the ocular surface, and there are lots of protective mechanisms in the tear film. So theoretically this should not happen, but to be on the safe side, a good advice would be that the lenses that people are disposing on the next day are kept in solution over the night, and after that they are disposed. And if the lens is daily disposable, just to be wrapped in a piece of clean paper and disposed in this manner. Of course, there are already questions from patients who are suffering from the disease. And the question is, can I continue with my contact lenses? Unfortunately, my answer here is no. Not because the infection is associated with particular eye problem, but because when somebody has pulmonary infection, high fever, the body is in completely different state. and there is a high chance microbes that are normally living into our conjunctiva, into our eyes, to be activated, and therefore there is much more chance for infection. Therefore, my advice will be, if they can, because there are people that even cannot see because they have only one seeing eye with a contact lens only, they should stop wearing contact lenses and should convert to glasses. When it comes to glasses, there are many questions. First of all is, are they really protective? Second is, how we should care about them. There is no still a solid evidence that wearing protective glasses is really protection against the infection, but it is a self-protection because we are touching our face very often, and that includes the eyes and the eyelids. So if we wear glasses, we actually prevent ourselves from such action. Another important thing is that the glasses are surface. Therefore, in situation of pandemic, we should clean them relatively often, which basically means that 3 to 4 times a day the glasses should be washed with warm water and soap and dried thoroughly. Another question that I usually receive is, should we switch to daily disposable lenses in case of pandemic? Well, theoretically and based on the literature, daily disposable lenses are associated with less risk of infection. But if patient is already having healthy habits with their monthly or bi-weekly lenses, or they're wearing lenses, for example, RGP, that are for 1 year, they cannot and they should not. So just follow the rules safely. And finally, if a patient with contact lenses is having a red eye, what they should do? Well, every patient who is wearing contact lenses should every day be absolutely sure that they see well with both eyes, that they feel both eyes very well, and their eyes are not red. If one of those events happen in situation of pandemic, they should pick up the phone and call their specialist. The specialist is the person to decide how serious their situation is. And very importantly, they should stop immediately trying to put the lenses in, and they should wear for this short period their glasses. Fighting with the redness together with your specialist is the wisest decision. I'm sure that there are many more questions, and some of those questions even we, the specialists, cannot answer yet. But we should stay together, we should exchange information, and we should fight together. So finally, I would like to wish everybody good general and eye health. Thank you very much.